Well, hello, dear viewer. I am Matthew Lawrence, Associate Professor at Emory University School of Law, and I am here to talk to you about the Affordable Care Act in pictures. And specifically, I'm talking about the individual marketplace parts of the Affordable Care Act. This is part one, our fragmented health insurance system. Just a broad overview, really necessary to understand part two, which will be about the ACA's design for our individual marketplace. And then part three will be about some of the legal challenges. But forget all those confusing words. I'm going to try to show this in pictures. So let's dive into it. Let's start here with our health insurance system. And my metaphor here is we have a lot of people out in the world and they're getting rained on. The rain is medical bills and healthcare expenses and sickness that requires healthcare coverage in order to get treated. And what we have in our country is various umbrellas, various ways to protect people from getting soaked out in the cold of medical bills. We do not have one umbrella. We do not have one system that covers everybody. Instead, we have a patchwork of different systems that cover people. I've grossly oversimplified it here in order to try to fit it into a picture. So I've just really shown a few of the really big mechanisms that we use to cover people, to give people health insurance. A really big one is Medicare. It's for people who are over age 65 and disabled, and Medicare is completely federally run and federally governed, federally paid for, and that's going to protect a lot of our senior citizens in particular from health insurance expenses. Second, another really big one is Medicaid. That's a joint project between the federal government and the states, and Medicaid is predominantly the low income. A lot of children on Medicaid. I think it's about half of births, and a lot of people in nursing homes, about half of nursing home stays paid for by the Medicaid program, really an essential program. Third, though, people who have full-time jobs, their employer will often provide them health insurance. They don't have Medicare, they don't have Medicaid, they have employer insurance, which might be from any number of private businesses, Aetna, United Healthcare, whoever it is. A lot of people have employer insurance, a plurality of Americans. And then fourth, prior to the Affordable Care Act, you might ask, okay, well, let's say I'm not over 65, I'm not low income, but I have a small business. I don't have a full-time job with a big employer, or I want to quit my job and I have an invention I want to pursue, or whatever it might be. I just lost my job. Where do I get health insurance then? And the answer was, it was very difficult to do. There was not really a functioning individual market where somebody could go buy health insurance. And there's a lot of reasons for that, and there's a lot more complexity to it, but that's the core of the concern that motivated the Affordable Care Act's reforms to that, the individual marketplace. And what the Affordable Care Act tried to do is make it so that there was an umbrella, there was coverage for people in that individual marketplace. Essentially, it tried to create a clearinghouse, regulated market where people could buy affordable health insurance from private companies, even if they did not have a full-time job that provided them with health insurance coverage. So the upshot is, the ACA's kind of goal here is to create a functioning umbrella, a functioning shield for people who do not have Medicare, Medicaid, or employer insurance to get them in and out of the cold. And let me do two last notes for this video, really key for understanding. First, if you love my picture and you probably hate it, you're thinking, why did I even click on this video? That's fine. You still might be curious, why are people getting rained on if they're under umbrellas? Those umbrellas don't seem like they're working very well. And I just needed to include that to be accurate. It is not true in our health insurance system, in any of the ways we have of covering people, that Americans never have to pay medical bills and are insulated against healthcare costs, because we have something called cost sharing. It might be a deductible you have to pay before your healthcare coverage kicks in. It might be a copay you have to pay when you go to the hospital or at the pharmacy counter. We have amounts that you're expected to pay even if you have health insurance. And there's a lot of reasons for that. There's a great book by Chris Robertson called Exposed if you want to learn more about that. But the upshot is that nobody is fully insulated from their healthcare costs. And I wanted to make sure not to be misleading in the picture. Second point, these videos, I am focused on the Affordable Care Act's effort to reform the individual market for those people who do not have Medicare, Medicaid, employer insurance. There's a lot of other things the Affordable Care Act did that I'm not going to have time to talk about. I don't want to mislead you. I'm just focused on that core component, or small component really, of the, well, it's a big component, but relatively speaking, it's not the whole thing. It's not even a majority of what the Affordable Care Act did. And the key point I want to give you is that Medicaid, that other way that low-income individuals get insured, the Affordable Care Act also did a lot to expand Medicaid and make it easier for states to expand Medicaid. And most states have now done that, although there are some that have not yet taken up the option. And that's all I have for this slide. That's a brief overview. I will post the other recordings on Twitter at MJB Lawrence, so you can go block that right now so you never ever have to get exposed to any more pictures like this. On the other hand, if you do want to click into the next video or are assigned by your professor to watch it, we're going to have even more confusing pictures coming up, and I'm sure you're looking forward to that.